It's 3 in the morning and you hear it from the other room, a sharp, dry honk, almost like a goose got loose somewhere in your hallway. You sit up in bed, heart pounding, and you wait. Silence. Then it happens again. Honk, 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 followed by a strange gagging sound like your dog is trying to bring something up but nothing comes out. You get up, you check on them, and they look at you like absolutely nothing happened. Tail wagging, completely fine. So you go back to bed, and an hour later, it starts all over again. If this sounds familiar, I already know exactly what you've tried. You probably called your vet, paid for an exam, maybe even paid for chest x-rays, and walked out with a bottle of cough suppressant that helped for a few days before the honking came right back. Or maybe your vet listened to your dog's lungs, said they sounded clear, and told you to keep an eye on it. You've spent money, you've lost sleep, you've Googled it at 2 in the morning more times than you'd like to admit, and you still don't actually know what's happening inside your dog's throat every single night. But what if I told you the single most important piece of information you need isn't sitting in a prescription bottle at all? What if the real diagnostic clue has been happening for free every single night right in front of you, and you've simply never been taught what to listen for? Today, I'm going to show you how to tell the difference between a cough that's mildly annoying and a cough that's quietly trying to warn you about something far more serious, using nothing but your own ears, a stopwatch, and information most pet owners are never given. Hi everyone, I'm Dr. Michael Carter, your neighborhood veterinarian. In my clinic, a coughing dog is one of the most common reasons owners walk through my door, and it's also one of the single most misunderstood symptoms in all of veterinary medicine, because not all coughs are created equal. Overexcited bark at the mailman is not the same as a cough caused by a struggling heart, even though to an untrained ear they can sound almost identical. Today we're doing a complete masterclass on canine coughing. Grab a notebook, because by the end of this video, you're going to be able to identify what kind of cough your dog actually has, what's likely causing it, and exactly what you can do about it tonight, completely free, before you even think about your next vet bill. Let's start with the most important concept in this entire video, the one piece of biology that changes how you'll look at coughing forever. A cough is not a disease. A cough is a reflex. Deep inside your dog's throat, windpipe, and the largest branches of their lungs, there are tiny sensors whose entire job is to detect irritation. The moment something tickles, scratches, presses, or inflames those sensors, your dog's brain triggers an explosive burst of air to try to clear it. That's all a cough fundamentally is. It's your dog's body slamming an emergency alarm button. The problem is, that alarm button sounds almost the same whether the irritation is something completely harmless, like a sip of water gone down the wrong way, or something that's quietly damaging your dog's heart over months or even years, which is exactly why you can't just listen for a cough. You have to learn to listen for the type of cough, and just as importantly, when it happens and what triggers it. Let's talk about sound first, because this is where almost every owner gets it wrong. If your dog's cough sounds like a goose honking, dry, sharp, and almost mechanical, and it tends to happen right after they get excited at the door, pull hard against their leash, or drink water too quickly, you're very likely dealing with one of two things. The first is what's commonly called kennel cough, a highly contagious respiratory infection that spreads anywhere dogs gather closely together, like boarding kennels, dog parks, daycare facilities, and grooming salons. The second possibility is something called tracheal collapse. Here's the biology behind it, and I want you to really picture this. Your dog's windpipe is held open by a series of cartilage rings, almost exactly like the rigid rings inside a vacuum cleaner hose that keep it from caving in on itself when you bend it. In certain dogs, especially small breeds like Chihuahuas, Pomeranians, Yorkshire Terriers, and toy poodles, those cartilage rings can weaken over time. When they weaken, the windpipe partially flattens every single time your dog inhales, and that flattening is exactly what produces the honking sound. Think of it like stepping on a garden hose. Air is still desperately trying to push through, but the passage has been pinched, so instead of a smooth, quiet flow, you get a forced, honking burst trying to squeeze past the obstruction. This is also exactly why collar pressure makes everything so much worse. Every single time your dog pulls against a standard collar, you are physically pressing down on an already fragile, weakened windpipe. I want to give you a real-world example from my own clinic. A client once brought in a 10-pound Pomeranian who had been honking violently every single time he got excited at the front door. The owner was convinced something was physically stuck in his throat. When we examined him, there was nothing stuck anywhere at all. His trachea was simply collapsing slightly under pressure every time his collar tightened against his throat. We didn't start treatment with medication. We started with one single change, and I'll give you that exact fix in just a few minutes because it costs you absolutely nothing. Now, I want to talk about a third type of cough, one that gets confused constantly with both of the sounds we just covered. If your dog suddenly makes a series of rapid, loud, honking inhalations while standing perfectly still, often stretching their neck out and pulling their elbows wide, that is very likely not a cough at all. That's something called reverse sneezing, and it happens when the soft tissue at the back of your dog's throat becomes briefly irritated, often from excitement, pollen, or simply eating too fast. It looks alarming, it sounds alarming, but in most healthy dogs, it resolves on its own within seconds and is considered a largely harmless reflex. I bring this up because knowing the difference between reverse sneezing and a true cough can save you an unnecessary, stressful emergency vet visit at midnight. Now let's talk about a completely different sound, and this is the one I need every single one of you to pay extremely close attention to because this is the one that genuinely concerns me as a veterinarian. If your dog's cough is soft, short, and almost wet sounding rather than dry and honking, and here is the critical detail, if it happens mostly at night or right after your dog lies down to rest, that timing is not a coincidence. That specific pattern is one of the earliest warning signs of heart disease in dogs. Here's why timing matters so much biologically, and I want to walk you through this step by step. When a dog's heart begins to struggle, most commonly from a weakening or leaking valve, blood that should be pumping efficiently through the body starts to back up instead. When your dog is upright and moving around during the day, gravity actually helps that fluid distribute and drain more evenly through the body. But the moment your dog lies down flat to sleep, more blood returns to the chest cavity all at once, the pressure inside the already struggling heart climbs even higher, and fluid begins seeping into the surrounding lung tissue. Think of it exactly like a clogged kitchen sink. During the day, with the tap barely running, the water level stays manageable and you don't notice a problem. But the moment you turn that tap up at night, the sink starts to overflow because the drain simply can't keep pace with the new volume. That overflow inside your dog's chest is fluid pressing against the airway, and that soft, repetitive nighttime cough is the body's desperate attempt to clear it. I want to be honest with you here because this is one of the harder truths in veterinary medicine. I've had owners sit in my exam room and tell me, he's just getting old, he sleeps a lot, he coughs a little at night, that's just normal for his age. And sometimes, genuinely, it is nothing. But I've also examined that exact same dog after hearing that exact same sentence and found a heart murmur with early fluid buildup already forming in the lungs simply because nighttime coughing gets dismissed so easily as just getting older. I want you to remember this clearly. Age does not cause coughing. Disease causes coughing. Age simply makes certain diseases statistically more likely to show up. Let me give you one more real-world example because I think this one will stick with you. A few years ago, an owner brought in her 12-year-old Cavalier King Charles Spaniel, a breed that, biologically speaking, is unfortunately predisposed to exactly the kind of heart valve disease we've been discussing today. Her complaint wasn't even about the cough at first. She mentioned, almost as an afterthought, that he'd been a little quieter on walks lately and seemed to settle into bed more slowly at night, almost as if he were trying to get comfortable and couldn't quite manage it. When I asked specifically about coughing, she paused and said, "Actually, yes, now that you mention it, a little, mostly after he lies down." That single detail, combined with a heart murmur I detected on exam, was enough to start him on cardiac medication months before he would have shown any of the more dramatic, frightening symptoms like labored breathing or collapse. Today, years later, he's still here, still slow on his evening walks, but stable, comfortable, and loved. That outcome existed because one detail about timing was mentioned out loud instead of being silently dismissed. So here is the free diagnostic tool I promised you earlier, and I genuinely want you to use this tonight, not next week. It's called Counting Your Dog's Sleeping Respiratory Rate, and it costs you nothing but 60 seconds of focused attention. Wait until your dog is in a deep, calm sleep, not dreaming, not twitching, not mid-nap with one eye half open. Watch their rib cage rise and fall and count how many full breaths they take in 30 seconds, then double that number to get breaths per minute. A healthy resting respiratory rate generally sits under 30 breaths per minute. If you count your dog breathing and you're consistently landing above 30 breaths a minute while they're fully at rest, or if that number has been quietly climbing compared to a few weeks ago, that is a signal worth calling your vet about, even if the cough itself still seems relatively mild. This one 60-second test, repeated over a few nights, gives you more concrete, useful information to bring to your vet than simply saying he's been coughing a bit. Now let's get into the fixes, because I promised you this entire video would cost you nothing, and I meant every word of it. The first fix applies directly to that goose honk cough we talked about earlier, the one tied to collar pressure and tracheal irritation. If your dog walks on a standard neck collar, I want you to switch to a harness today, completely free, using whatever harness you already own at home. A harness distributes pressure evenly across the chest and shoulders instead of concentrating it directly onto a fragile, cartilage-ringed windpipe. For small breed dogs especially, this single swap alone can dramatically reduce how often that honking episode gets triggered in the first place, because you're physically removing the pressure point that's been pinching their airway on every single walk. The second fix is about humidity, and it's something nearly every owner completely overlooks. Dry indoor air is genuinely irritating to an already inflamed airway, whether that irritation is coming from a viral infection, environmental allergies, or general airway sensitivity. If your dog is coughing, simply sitting with them in a bathroom while you run a hot shower for 10 to 15 minutes lets them breathe in warm, moist air, which can help loosen secretions and calm an overactive cough reflex. If you already own a humidifier, running it overnight in the room where your dog sleeps does this same job continuously, completely free if you already have one sitting in a closet somewhere. Now, I do want to mention honey because many of you have likely heard it can soothe a dog's throat, and there is some real truth there. A small amount, roughly half a teaspoon for a small dog up to a full tablespoon for a large dog, can coat an irritated throat and may temporarily ease coughing episodes. But please hear this vet warning clearly, because it matters. Honey should never be given to puppies under 1 year old due to a rare but genuinely serious risk of botulism. It should also be avoided in diabetic or significantly overweight dogs because of its sugar content. And I want to be crystal clear about something else. Honey is a comfort measure, not a treatment. It does absolutely nothing to fix a collapsing windpipe, clear a respiratory infection, or support a struggling heart. Treat it exactly as what it is, a temporary throat soother, never a substitute for figuring out what's actually causing the cough in the first place. Let's talk about one more piece of the puzzle that ties everything together, because just like every other part of your dog's health, their respiratory system doesn't exist in isolation. A dog with chronic, low-grade airway inflammation from allergies or repeated irritation is more vulnerable to coughing flare-ups in general, simply because their airway is already primed and sensitive. If your dog seems to cough more during certain seasons, or alongside watery eyes, itchy skin, or a runny nose, environmental allergies to pollen, dust, or mold may be playing a role underneath everything else. This doesn't replace anything we've already covered. It simply means that reducing your dog's overall exposure to household irritants, things like strong cleaning chemicals, cigarette smoke, scented candles, and heavy aerosol sprays, can genuinely lower how often that cough reflex gets triggered in the background, regardless of which specific cause is driving it. This brings me to the section of this video that matters more than every other section combined, because as much as I want to hand you free, practical tools tonight, my responsibility as a veterinarian is making absolutely sure you know when those tools stop being enough. If your dog is coughing up any blood at all, even a small streak, that is an emergency and you need veterinary care immediately, not in the morning. If your dog's gums look pale, gray, or bluish instead of a healthy bubblegum pink, that means their body isn't getting enough oxygen, and that is also an immediate emergency requiring urgent care. If your dog suddenly starts coughing violently after spending time outside, especially in tall grass, and seems to be gagging, drooling, or pawing frantically at their mouth, they may have inhaled a foreign object like a grass seed or awn, and that requires same-day veterinary attention to remove safely. And if your dog has ever fainted, collapsed, or seemed to lose consciousness for even a few seconds during or right after a coughing episode, please do not wait for it to happen again. That can be a sign of a heart that is struggling significantly more than a simple cough would ever suggest on its own. I also need to mention heartworm disease because it is a real, documented, and entirely preventable cause of chronic coughing in dogs, transmitted exclusively through mosquito bites. If your dog isn't currently on a veterinarian-prescribed heartworm preventive, a persistent cough is one more reason to bring this up directly at your next appointment, because heartworm-related coughing can look deceptively mild in its earliest stages, all while quietly causing lasting damage to the heart and lungs the longer it goes unaddressed. So let's bring everything we've covered together into one simple plan you can actually start using tonight, not someday. Step 1. Listen closely to the sound itself. Is it a dry, mechanical honk, a soft, short, wet-sounding cough, or actually a burst of rapid honking inhalations that might just be reverse sneezing? Step 2. Track the timing carefully. Does it happen with excitement and leash pressure during walks, or specifically at night and right when your dog lies down to rest? Step 3, run that free 60-second sleeping respiratory rate test for a few consecutive nights and actually write the numbers down somewhere so you have something concrete and specific to hand your vet rather than vaguely saying, "He's been coughing a little lately." And step 4, apply the appropriate free fix tonight, whether that's switching to a harness, adding humidity to the bedroom, or simply paying far closer attention to exactly when those coughing episodes are happening and what comes right before them. I want to be completely transparent with you. None of this replaces a proper hands-on veterinary exam, and if anything in this video sounded like your own dog, please use everything you learned here to walk into that appointment far more informed, not to avoid the appointment altogether. What this video gives you is something genuinely valuable that most owners simply don't have: the ability to describe the exact sound, the exact timing, and an actual resting respiratory rate number, instead of just telling your vet he's been coughing. That single piece of preparation alone can completely change how quickly your veterinarian arrives at the right answer. I know hearing about cardiac coughing and emergency warning signs in the same video can feel a little frightening, especially if you've quietly brushed off a nighttime cough as nothing for weeks or months already, but please don't walk away from this video carrying guilt. Walk away carrying awareness instead. The simple fact that you're sitting here right now, learning the real difference between a goose honk, reverse sneezing, and a heart-related nighttime cough, means your dog already has the single most important thing they could possibly have: an owner who actually pays attention to the details most people overlook completely. If this masterclass helped you finally understand your dog's cough in a way you never had before, please take a moment and hit that like button. It genuinely helps this kind of free veterinary education reach more worried pet owners exactly like you. Make sure you're subscribed so you never miss the next deep dive into your dog's health. And I really want to hear from you down in the comments below. Does your dog's cough sound more like a honk, a soft nighttime cough, or maybe even that reverse sneezing pattern we talked about today? Tell me everything, and let's figure it out together as a community. Give your sweet dog a gentle scratch behind the ears for me tonight. Stay safe, always trust your instincts, and I'll see you all in the very next video.